Okay, welcome to the part 2 of the cardiovascular system. The last thing we reached last time in part 1 to the capillaries. Capillaries are the smallest blood vessels. Some of these capillaries only consist of one cells. We can see here one cells, and we can see this area here between the cytoplasmic processes we have adhesions. Okay, and inside here where we have the lumen of the capillary. Most of the time the capillaries consist of the tunica intima, the simple squamous epithelium, which is the endothelial cells, with the underlying from outside we have the basement membrane, and usually from outside we have reticular fiber. As we know, capillaries is the site of the gas and nutrient exchange. As I said, these capillaries, and you can see here the area of the adhesion between them, and inside here we have the lumen. Usually these capillaries consist of one cell endothelial and surrounded by one cell which is the pericyte, and this pericyte is mesenchymal like stem cell which found around capillaries, and this cell is very important in wound healing because these pericytes may differentiate into fibroblast or smooth muscles. We have small capillaries and large capillary. The smallest capillary just consists of one cell, whereas the large capillaries consist more than one cells. The smallest capillary can hold only one red blood cells. We have different type of capillaries. We have the closed capillaries, we have the fenestrated, and we have the sinusoid. If the wall is continuous without any perforation, without any pores, we call it closed, and this one is found in the central nervous system. If the wall contains small pores, that will be the fenestrated, and this is found in the intestine. And if they have large pores, then this type is called the sinusoid and found in the liver and in the endocrine system. In the closed capillary, we can see this the red blood cells, and here this is the area of the adhesion between the cytoplasmic processes. And usually the material will pass in and out of the capillary through the process transcytosis. See, this is the transcytosis, and we can see it's bidirectional, and there is no any lost in the cytoplasm or the plasma membrane. The material will be uptake from this direction through a vesicles, then it will be released for outside without any loss in the cytoplasm or the plasma membrane. As I said, continuous, there is no any fenestration. It's found in the muscle, connective tissue, central nervous system, exocrine, and gonads. And as I said, this is the area where we have the adhesion between the cytoplasmic processes for the formation of the capillary lumen. The second type we have is the fenestrated. The wall is perforated. As we can see, there is this opening, and from this opening the material can pass in and out of the blood capillaries. Location in the mucosa of the GIT, in the digestive system, endocrine, adrenal system. See the difference here in this one here, the transcytosis, whereas here, as I said, they can move through these fenestration. See this one here, all of these opening are, so you can see here all of these fenestration. This is the fenestrated capillary. And the last one, which is the sinusoid or sinusoidal capillary, it's found in the liver, on the homopoietic organs or the endocrine organs. Usually they have large pore. These capillaries are large, irregular, tortuous wall, wide gap between the cells, and that the the most important thing. And the other thing, the basal lamina are incomplete to allow the maximum contact between the blood and the organ cells. So we can see here, this is the large opening which allow the red blood cells to be in contact with the cells from the different organs, for example, the liver or the endocrine. Now I'm going to talk about the veins. The veins, the wall construction similar to the arteries, wall is thinner and looser. Tunica media, usually thin. This is the most important thing. The tunica media is thin and sometimes absent. But one feature is that the tunica adventitia is the most prominent and most well developed. Tunica intima, same as the tunica intima of the artery, but rarely the internal elastic lamina can be seen. The wall is thin and compressible. Muscular contraction generates the pressure. Usually, the movement of the blood inside the vein not depends on the tunica media. Usually, due to contraction of the muscle around the veins, and that will help in the movement of the blood. The second thing, the veins most of the time contain valves, and these valves only found in the lymphatic or in the veins. It does not found in the arteries. So the veins return blood to the heart, start as venules, again consist of tunica intima, endothelial cells, media 1 to 2 layers of the smooth muscle or sometimes is absent. The tunica adventitia, several layers of the collagen fiber with the dense irregular connective tissue. Here again we see the tunica intima, tunica media, and finally we have the tunica adventitia, which we can see it's very well developed and most prominent from these three layers. The first vein is formed after the capillary. Is called the post-capillary venules, which receive blood from the capillaries, have incomplete layer of pericyte. Later, these venules will have complete layer of pericyte, and later, this pericyte will be replaced by smooth muscle. Then this vein will be called muscular veins. These post-capillary venules very important because they are the site of activity of the inflammation. Usually at this area there will be a secretion of the vasoactive compound, which is histamine and serotonin, which affect fluid extravasation and migration of white blood cells from the blood vessels to the surrounding tissue. After that we have the small to medium sized vein. They have thin subendothelial connective tissue, but still they have tunica intima, media, adventitia, and again they have very well developed tunica adventitia, and these tunica adventitia may contain smooth muscle. So this is the arteriole and this is the venule, and to differentiate between them, most of the time the arteriole is regular in shape, circular, whereas the venule is irregular in shape. The second thing, here we could see 2 to 3 layers of the smooth muscle. Sometimes here we can see 1 layer, or sometimes we could not see the smooth muscle. The third thing, the tunica adventitia is well developed in the venules compared with the artery. So again here, this is the venules, this is the arteriole. You can see here we could not discern the smooth muscle or resolve the smooth muscle, whereas here we can see the smooth muscles. This small one, this is the tunica capillary. These are the all of these structures that we can see here, all of them are capillaries. Again, this is the venules, this is venules, This is post capillary venules, and it's not easy to differentiate because these only contain endothelium with the perisite. Then we have the large veins. We have cranial and we have the caudal vena cava beside the portal tract. The intima is similar to the small vein. We have thin media, and very important, we have very thick tunica adventitia. And this tunica adventitia, dense irregular connective tissue, and it contains longitudinal arranged smooth muscle. So the smooth muscle may be absent in the tunica media, but we could see it in the tunica adventitia. Most of the time, veins, as I said, contain valves, and these valves is found from a small to medium sized vein, and these very important to prevent the retrograde blood flow. As I said, the movement of the blood inside the vein depend on the contraction of the muscle. For example, in the lower limb, we have to move so the blood can, through the contraction of the muscle, push to the heart. But we don't want this blood to return back to the lower limb, so the valve prevent this blood from the retrograde. And usually these valves are paired, found in doubles. They are semilunar folds, and usually they are covered with the endothelium. So this is the artery here, whereas this one here, this is the vein. You could appreciate the number of layers here, regular versus irregular in shape. Also, we have this valve. This valve from outside, you can see this is the tunica intima. It's almost like extension of the layer of the tunica intima. From outside, we have the endothelium, and in the middle, we have the subendolying connective tissue. See again here, this is the valve, which is an extension from the tunica intima. This is covered by the simple squamous epithelium, and in the middle we have the subendolying connective tissue. Again, all of these structures that we can see here are the veins, and we can see inside we have this structure here, which is the valves. Now I'm going to talk about the arteriovenous anastomosis. Most of the time we have artery, arteriole, capillary, then we have the post-capillary venule, then we have venules and veins. But in some areas there is direct connection between the arteriole and venules, and these we call it as the arteriovenous anastomosis. Usually in this anastomosis we have specialized tunica media which work as a sphincter to control the blood flow. If the shunt is closed by the sphincter, the blood will flow in the capillary bed and from the capillary bed toward the veins. But if this shunt is open, the blood will bypass the capillaries and go directly toward the venules. See here, this is the area where we have the valve. If the valve is open, the blood will go directly to the venules. But if this one is closed, the blood will go to the capillaries, and from the capillaries will go to this way and this way. Okay, so as I said, these shunts are controlled by sphincter, and this sphincter most of the time consists of smooth muscles.